We are back once again with Max Schenk. He is the Director of Public Health for the City of Gloucester. How are you, Max? Thanks for joining us again.
Doing great, folks. Kory, Heather, once again, thank you for the opportunity to be here.
So,
Great to have you.
Max, there's a lot to unpack, obviously. We just saw the recent article from the Times about a little bump we have in COVID numbers through, I think the city sewage is tested for the virus often, and those numbers keep fluctuating. Can you just kind of give us the lowdown on where we're at with COVID?
Sure, as was predicted in our BioBot numbers, so BioBot is the organization that does our testing at the wastewater treatment plant. They had started showing an upward tick, and it was reflective of what we were seeing and what other communities, it's not just us. I mean, I had a conversation with colleagues throughout the region yesterday, and they're all seeing the same pattern. Our positivity rates right now are at 6.9% thereabouts, so that's significantly up. Our latest case numbers that I just received today, so this is from 5/2 to 5/4, so we have 46 new cases. We have 40 active of those and one in the hospital. So what we really look at in instances like this is, the hospitalizations. And thus far, the hospitalizations have stayed very low. Normally, they were actually at zero. So we've only had a couple of occasions where it's bumped up slightly. Excuse me. So given that, I think it's proof, and what we keep on talking about here and elsewhere is that vaccinations work, and that vaccinations are necessary to help people stay at home rather than have to go into the hospital with severe symptoms. And to that end, we once again put on for the second booster, put on clinics last week at the Gloucester Housing Authority properties, as well as the Rosebaker Senior Center, where we had over 130 people show up, which was fabulous. We're looking obviously at, waiting like everybody else to see if the under fives, when that's going to be made available for them. And we're in communication with obviously our vaccine team to talk about doing further clinics, general clinics for the public. So stay tuned on that, but it looks like we probably will be, but we have to check with our partners to make sure that it's going to work for them as well.
Gotcha.
So, Max, I have a question about this. I just recently looked at the national map, and New England has a very high rate of positivity, but it also has a very high rate of vaccination and boosters.
Mhm.
So, what are people saying about that?
Well, it's in terms of what the cause is for the rates going so high, that's kind of hard to tell. There are different variants flying around now that are hitting people. But I think, it is indicative of the fact that people, once the barriers were let down and gatherings were starting to happen and people are starting to have weddings and other things going on, that, people were becoming less cautious about what they were doing when they're outdoors. People not wearing face coverings while they're indoors with people where they don't know what their vaccination status is. Like I said before, I think the important thing to note is the hospitalizations and death rates. And sadly, we did have a couple of new deaths, or one new death, excuse me. There are a lot of mitigating factors to that one that I can't go into, but and hospitalizations have been incredibly low. That's your vaccinations. That's why those are important. You have a number of people that have contracted the virus who are likely not going to the hospital and staying well enough to stay out of the hospital because of that. So, lesson learned for everybody, and we keep preaching to everybody about this, is that, we know that, there are fewer people going to the hospital, but let's face it, it's important to get vaccinated, and you should be wearing a mask. I was in a meeting yesterday where, I was the only person in the meeting wearing a face covering. And, it wasn't just to, not only talk the talk, but walk the walk. It is the reality, because you just don't know. Just because you're feeling well doesn't necessarily mean you're not carrying the virus and can't transmit it to somebody else. So, the other thing I want to note too is that you may have heard in the paper or elsewhere, Curative, who had been the organization that was doing the testing up at Stage 4 Park. It's summertime, we're getting close to it, it's that season. So they needed the space back at Stage 4 Park, but they are going to be they are now at the O'Malley School parking lot and we'll update the information on our website so people can find it. But if you go to the Curative website and type in Gloucester, and their search engine will pop up. But they're at the O'Malley School parking lot for the same 6 day a week. They only take a break between 1:30 and 2:30 to account for buses coming through and that sort of thing. So we're fortunate to still have testing going on in the community, which is hugely convenient. It's difficult to get people off island for where you can get PCR testing done. So we're glad for that.
Yeah. So Max, now as we move our way through spring and look towards summer, well, we have graduations coming up. We know Fiesta's back on, the Horribles parade, et cetera, et cetera. The tourism season. Are you worried about backsliding at all, or is it just full systems ahead at this point?
I've been worried about backsliding the whole time through. So it's not just for those occasions. I think what helps is the majority of those events are outdoors. And, it makes a huge difference. A lot of what we're seeing are people in close proximity indoors. The best we can do without having any regulatory authority through the federal or state government, or even our own local requirements, is to keep preaching wear face covering when able to and wanting to, and take proper precautions. I mean, if you're in a party and you're not quite sure, I get not wanting to be the nerd in the corner wearing a face covering.
Which you are.
Yes, which I am often.
And I will be. Yeah.
But take proper precautions, and we'll let time tell the tale and see what happens. It's very tough. The crystal balls have been kind of muddy these days, so it's hard to predict how things are going to play out.
Mm-hmm.
Yeah, it just feels like anecdotally there are a lot of people who have COVID right now.
Yeah.
And do you hear anything about long COVID?
Not particularly, no. I mean, we hear stories of people who've had COVID before who are getting it again.
Mm-hmm.
So that's less and less unfamiliar, if that's I can use a double negative. But in terms of long COVID, we haven't heard of too many folks, at least being directly reported to us as having issues related to that. It's not unknown, but it is still relatively rare at this point.
Mm-hmm. No, it feels like there are a lot, but they're behaving like they're going through a bad cold. It definitely seems from the people I know that the symptoms they're tough,
Exactly.
but they're not hospitalizations. Yeah.
That's exactly what we're hearing as well. And again, getting back to the whole vaccination preach,
Mm-hmm.
definitely if you're able to and eligible, get those boosters.
Mm-hmm. Well,
All right.
Max, you and I, I'm sorry, Kory, you want
No,
to
go ahead, Heather. You go run with it.
All right, only because I have been talking to Max a few times about this.
Yeah.
The opt-out program for the state's mosquito spraying program. And we spoke maybe a month ago, and I asked you about it. We checked in and you said, yep, last year we were kind of taken by surprise that the municipalities had to opt out of the state's mosquito spraying program, but you're all set to go. And, Gloucester chose last year to do that, and they probably will this year, but everything changed, right?
Yep. Womp womp. So, so we were, so let me back it up a little bit. If it's okay, I'll give a little bit of background to this.
Mm-hmm.
Please.
So a lot of communities in Massachusetts belong to a mosquito control district. And what that means is that, by contract annually, they can opt in for, spraying if they feel it's necessary, adult, which means larviciding or adulticiding of mosquitoes. They can, it can be for monitoring for mosquito activity in their community, education outreach, whatever. It's a package deal. And Gloucester is not one of those communities because, frankly, our, in terms of Triple E and West Nile virus cases, we've had little to none. I mean, I don't remember any West Nile virus or Triple E cases, at least in our community since I've been here 16 years. So that left us in a great position for the opt-out last year. So that's a mosquito control district. What this new regulation says is that if the state, so that's the State Reclamation and Mosquito Control Board, I live in an acronym universe, the State Reclamation and Mosquito Control Board, and in cooperation with the Department of Public Health, deem there to be an emergency in the area based on, numbers of triple E cases or triple E discovered in mosquito, captured mosquitoes and that sort of thing. If they consider there to be an emergency, they will do spraying regardless, unless you opt out, which is what we did last year. They had criteria, and at that time, we were considered a low risk community. Now I'm highlighting that because it's important as we move forward. So as a low risk community, we were able to put in an opt-out application. We had a lengthy narrative in regards to the education and outreach that we do based on certain criteria to the emergency levels indicated by the Department of Public Health, et cetera, et cetera. That application was received and approved, and we were fine. Well, fast forward, and we thought it was going to be the same this year. Shout out to Patty Page and her crew who were monitoring this extensively and kind of gave us a heads up because we can't be everywhere all the time, and they know that. But there were changes, and there was an incredibly two significant changes. And the first one was it's no longer whether or not you were a low risk community. They changed that to, so we went from being a low risk community to being in a high risk region. So even though we haven't had those cases here in Gloucester, nearby communities have had cases, and so we were grabbed and brought into that region as part of that. You'll notice if you look at the map that they have at the state, Rockport is a low risk community because we didn't have any cases and they didn't either. So now the other significant change is that if you're considered to be in a high risk region, if you're marked off in orange on their map, which we are, if you want to opt out, you have to prove that you have equal capacity for performing spraying or other measures as needed as would have been performed by the state if you were not opting out. So
your city has to own a plane.
Your city has to own a plane and the trucks and all the other equipment that would be needed in order to perform those services that would be needed if the state declared there to be an emergency. The one thing they did offer is, and this is the thing I would put out to the community, is individual property owners can opt out. Now, individual property owners, I'm not quite sure how this is going to work for aerial spraying if they ever decide to do that. But for drive-by truck spraying, you can opt out. There are certain requirements you can apply online. It's all, and this is something I want to highlight because I hear feedback from people in the community is that they think they have to provide that to the health department. They do not. That application that is all through the state, has nothing to do with us whatsoever. So,
we will have a link to that application actually.
Yeah. Thank you. So that's your best way of opting out as it were. However, caveat as always with the state, if the state does declare that there is an emergency and to the extent that they can supersede those applications and do the spraying regardless, depending on which area might be of particular concern. So just keep that in mind. So really what they've done is just made it impossible for, if you're in a high risk, what's considered a high risk region, they've effectively made it impossible for you to opt out because let's face it, no community has that capacity unless they're part of a mosquito control district already, and then you do have that capacity.
So is there a possibility that Gloucester would join a mosquito control district?
I'll leave that up to the city council and the mayor's office. That in the past at least has come with the high cost. So when this discussion was brought up, gosh, 3-4 is definitely, I'm putting everything pre-COVID, post-COVID. So about 3-4 years ago when we had this discussion and we investigated it, and at that time, it may have changed, so I apologize. It was a mandatory 3-year contract. So Mass Mosquito Control District, Northeast Mass Mosquito Control District wanted you to have a 3-year contract. And it's based on your cherry sheet evaluation from the state, which is the amount of state funding you get to your community. And it was a certain percentage of that. Our outlay as a community at that time was in the vicinity of $80,000 a year, so mandated for 3 years. And the cost benefit analysis at that time, and rightfully so, as far as I'm concerned, is that we haven't had any cases. We've done well with education and outreach. We have things we could potentially do if we do see upticks. So we're not, why spend the money if we don't need to?
Mm.
But now we're getting shoehorned into this, like it or not.
That's interesting. I wonder how this affects private companies that provide mosquito and tick spraying services.
That's an excellent question, but it doesn't. You can still, if you're a private property owner and contract with those services, you absolutely can still contract them. It doesn't impact that at all.
So does this mean that the state will definitely spray?
No, what it means is that the state, well, it's going to be a confusing answer, but it does mean that the state can spray if they deem there to be an emergency. It's not like they're just going to seasonally go around and start spraying everybody. It's only if they and the Department of Public Health deem there to be a high level of concern and declare an emergency, but they have to go through a process in order to be able to do that.
Okay. Well, something to stay informed with. I'm sure we'll follow up with you on that one, Max. Do we
Absolutely.
want to get into greenhead boxes?
How far into a greenhead box do you want to get? So
We just want to ask you if there are pesticides also in those greenhead boxes.
So the material that's being used, and I'm forgetting the name of it, so I apologize. But the material that's being used is considered an attractant, and so it's also considered a pesticide only because the end result of its existence is that mosquitoes, or excuse me, greenheads. Why would I get confused? Greenheads, and we've all seen them. We've seen them on the marshes all over the place.
Yeah.
They look like sculptures out there. But anyway, the greenheads are naturally attracted to go underneath animals because that's where the tender parts are and the less hair is. And so it's a natural instinct for them to go under. They're attracted by the scent that's emitted by these bits of bait, essentially, and they go up and in, and they become trapped once they're in there, and they die of natural causes at that point, semi-natural causes. The material itself is not declared really by the the FDA as being a poison necessarily. It is, you can have adverse effects if you swallow it. And if you're that desperate for a meal and go out to the marsh that way, it's not, as if anything would be possibly a mild irritant, but it's got its lowest rating for that. But the only reason why it's considered a pesticide is only because the end result is that it is causing the death of an insect, but it in and of itself, forgive me, is not what's causing that death. So they are not ingesting that and then dying from that.
So this issue has come up it's to me, and there is a really fundamental question. If I tried to put a mild irritant around my little quarry in the backyard, the Conservation Commission would be pissed off, and they would not. I mean, I'd have to go through a lot of hoops to add something to my quarry or near my quarry. So does the Conservation Commission have any issues with putting these greenhead boxes in the
No, it's another excellent question. So and let me back up in terms of process. So this all came forward. This is not a Board of Health initiative at all. There's no public health benefit to doing this. It is regarded as a feel good, help people, increase people's comfort is really what I'm trying to say.
It's a nuisance, right? So
it's a nuisance more than anything. And you're not eliminating greenheads, as we've seen for all the boxes that are around. You're not eliminating greenheads whatsoever. But the board was the first step, in the folks who wanted to see these put back on the marshes near the Wingersheek area primarily, and wanting to get some support from the board towards the idea. And so board members discussed it. There were some concerns like you've mentioned. We looked it up and discovered what the reality was in terms of the material that's used. discovered during that process also that it wasn't just, oh, can we get your support? Also, you're responsible for having it in your budget and overseeing it from here on in.
Mhm.
Fine. But the Northeast Mosquito Control District actually oversees the installation, removal, and maintenance. So it's low on that. But anyway, so one of the requirements that came up, because I brought up the same question, have you been in front of the Conservation Commission to talk about this yet? And they said, no, typically we don't have to. And the board was like, time out. And that is going to be one of the requirements that we have for our providing support to this initiative.
For the Board
And
of
so-
Health to provide the support, yeah.
Yeah, exactly. So when I sent the memo to the mayor's office regarding the board's feedback on it and support, it came with the caveat that it would have to go through the Conservation Commission's request for determination of applicability in order to receive that support. So the conservation agent received a copy of that. I'm not sure where it is in their process. I know that it was brought up at the city council meeting most recently, and that the administration has put funding for 20 boxes this year, and they'll up it to have a total of 58 boxes supposedly next year and next fiscal year. But 20 is all they had available for this fiscal year anyway. And so I'm sure there'll be further discussion about it during the budget process. But again, we're kind of out of it at this point. It's up to the city council and the administration to decide whether or not they want to continue forward.
Gotcha. All right, Max, anything else you need to relay to us?
Oy vey. Okay, what do we got? So, ticks. We want to talk about ticks. We love
Yes,
ticks.
please. You know
You
that.
are our insect expert.
Yeah, since we're on the theme.
Yeah.
And I seem to be suffering from all the insects too.
Yeah. But ticks is, not that mosquitoes aren't, and not that, even greenheads for what they do and the irritation that they cause isn't a problem. But ticks are a very real issue, especially in the Northeast.
Bad.
Yeah, it's bad. We are a hot spot, essentially, especially in the
Yeah.
West Gloucester area, obviously, with all those wonderful woods that everybody loves going to and escaping the world to. And it's still safe and it's still wonderful, but you should take proper precautions. So Lyme disease is carried by black-legged, ticks, which means deer ticks in our area. And they call it a deer tick, but really it starts with, and I believe if I'm remembering correctly, the virus starts with white-footed mice. And so it's transferred from the white-footed mice to the ticks, and then from there to the deer occasionally. So you will see, it's common in areas where deer go through, but frankly, they're common everywhere. I think, Heather, you and I were talking about this previously, and I happened to mention when I was on the Conservation Commission years ago, thankfully, I was wearing a white shirt, and I went through a brambles area in the property we were looking at in West Gloucester, and I walked out, I was covered, absolutely covered.
It's just amazing. Yeah.
Yeah. And there are better seasons than others, in terms of their population. But I think people can get a false sense of comfort. Well, it's cold weather out, they won't be that active. Not so much.
Totally.
As soon as it's over like 45 degrees, 50 degrees, they start becoming active.
Mhm.
And so, but proper precautions, use tape up your legs, or you put your socks over your pant legs. Try to make sure that your sleeves are pretty tight, your collar is pretty tight, wear a hat or a cap. They say they're attracted more to dark clothing than light clothing. Not based on my experience, at least, they weren't. I think they're opportunistic. I think whenever they can catch a ride and probably get a blood feast, they will. So, spray yourself with DEET or some similar, insecticide to help. And then when you're done with your walk, check yourself top to bottom. And just be careful. It is not something you want to, play fast and furious with, or we've all had somebody, I believe at this point, who has been adversely affected by Lyme disease. The treatments for it, there are antibiotic treatments that work effectively, but you don't want to wait too long. The problem, I was doing some reading up in preparation on the CDC's website, and I'll put this information up actually on our website. But people are saying, well, some of those tests really don't work very well, and you need this XYZ test because it's the best test. And what the CDC actually says is that it's not that they're bad tests, they're actually good tests. It's that sometimes people get tested too soon before the antibodies that are created that these tests look for are in such sufficient numbers as they're detected, or which is a common practice, and I've had this happen because of that other experience, where you go in and you have a tick pulled and they put you on antibiotics immediately. So that may reduce the level automatically. It's not that you don't have it, so you might get a false negative. It's that you do have it, but the antibiotics are doing exactly what they're supposed to be doing. So yeah, caution is the word. It's the symptoms on that. I'm really familiar with hearing about the bullseye mark on there, and it can take up to 24 hours for the tick. So if you have a tick on you for at least 24 hours, that's when you really have to be concerned. So if you can, detect in your mind, well, we were out the day before yesterday, and I'm just finding this thing now because it was kind of tucked in. So it can take upwards of 24 hours. If it's less than that, there's less of a likelihood that there's been transmission, but I'd rather be more cautious than not. So.
Do you have any experience with these this clothing you can purchase that's treated with, no bug, more pesticides, but it's supposed to be treated to keep the ticks away?
I'm sure it helps, but whether or not it's a panacea for everything, probably not. I would always, again, err on the side of caution and do the double check anyway. I'm sure it's helpful, but like I said, they're opportunistic, and you walk along in the woods to have a quiet moment and enjoy nature, and you're not necessarily paying attention to everything that you're doing. And they're tiny, they're not big, they're grain of rice size at most, and so they'll find their way. I mean, you never know, it could be under your neck, collar, what have you. So yeah.
No, I think we commented on the irony of having, planes and trucks and all these things as trying to get rid of the mosquitoes when those ticks can make you so sick. I mean, it's such a serious issue.
Yeah. In terms of, again, and I feel nothing but empathy for folks who come down with West Nile virus or Triple E. It's a horrible disease, but comparatively, more people are suffering from Lyme disease in terms of public health measures. So yeah, getting the word out and reminding people to be cautious, to be observant wherever they are, is key.
Well, Max, let's catch up a few weeks down the road and see how all these numbers are doing.
Exactly.
But we really appreciate your time today and helping us sort through a bunch of little hot button topics we're going through right now as a community.
Busy times in public health, that's for sure. So.
Thanks for your time, Max.
You. Yeah, we always
thank you, folks. Always appreciate the opportunity.
Interested in a sponsorship? Email sponsor@1623studios.org to learn more.